It is the third day of the ongoing Vijayadashami festival. The celebrations this year are relatively subdued amid the coronavirus pandemic, with the number of infections continuing to witness a dramatic surge. Meanwhile, on the day when the global infection tally went past 40 million yesterday, the government back home has announced that it would no longer offer free PCR test and treatment, contrary to the Supreme Court directive and constitutional provisions. Good morning, I'm Amar Singh Pradhan, and these are the headlines of the hour. The government says it will no longer offer free of cost test and treatment for COVID-19 now onwards. National infection tally goes past 131,000. Domestic air ticket prices slashed to half due to low passenger pressure despite the onset of the festive season. At least 11 soldiers killed in a deadly landslide in Vietnam, while frantic search is underway to find more missing soldiers. And Kings 11 Punjab prevail in a thrilling super over to clinch crucial points against Mumbai Indians in the ongoing Indian Premier League. (2,942) new cases of COVID-19 were confirmed in the country yesterday, taking the total number of coronavirus cases to 132,246, while 12 more COVID-19 deaths were also reported to take the COVID-19 death tally to 739. Speaking at the regular press meet yesterday afternoon, spokesperson for the Health Ministry, Dr. Jageshwar Gautam, informed that out of the newly infected, 1,698 infected cases were reported from the federal capital yesterday. Kathmandu district alone confirmed 1,469 cases, while Lalitpur reported 130 cases and Bhaktapur witnessed 99 cases. Likewise, 2,926 individuals registered full recovery yesterday itself, taking the national recovery tally to 92,166 as the recovery rate stands at 69.7%. According to the Health Ministry, there are over 39,000 active cases in the country, out of which 12,933 are in isolation centers, while 26,408 are in home isolation and 4,831 individuals are in quarantine facilities. The ministry informed that 66 patients are receiving treatment with ventilator support, while 301 are in intensive cares. The government has said that it would no longer offer free of cost tests and treatment for COVID-19 now onwards, challenging constitutional provisions and the Supreme Court's directive to carry out free PCR tests and treatment of coronavirus patients. We have more in this report.
Government hospitals, following the Supreme Court directive, had been carrying out free PCR tests. However, with the government's decision on Sunday, public are now compelled to pay charges for the treatment they receive. The Health Ministry has fixed 3,500 rupees charge for COVID-19 patients with mild symptoms, while 7,500 rupees for severe symptoms and 15,000 rupees for critical patients for both government and private hospitals. The ministry, revealing the cabinet decision taken 2 weeks ago, informed that the government would no longer bear free of cost test and treatment for COVID-19. The Supreme Court had issued a directive to carry out free PCR test and treatment 4 days before the government's decision. The government is constitutionally bound to provide free services for basic healthcare, including treatment of infectious diseases. The government, meanwhile, has decided to carry out free PCR test and treatment of only low-income group, security personnel and frontline medical staff. However, it has not identified the low-income group. Constitutional experts have flagged the government for its unilateral decision, overlooking the constitutional provision and the Apex Court's directive, terming it as anti-constitutional and even contempt of court.
The domestic airlines used to increase the airfare with the surge in number of passengers in previous years, targeting Dasai festivities. The passengers used to face a hard time getting the tickets despite increased airfare. Meanwhile, the airfare is half of what it used to be this time around due to the less passenger pressure. We have more in this report.
The passengers last year had paid airfare up to 7,000 rupees for a flight from Kathmandu to Biratnagar. Meanwhile, tickets are available for only 1/3 of the fare for the same flight this year. The air ticket charges have been declining for other routes as well. Tickets for Kathmandu to Bhairava are available at 2,500 to 3,500 rupees, which was over 5,000 rupees during the Dasai last year. Likewise, it cost 3,500 rupees for a ticket to Nepalganj from Kathmandu, while passengers had paid up to 9,000 rupees last year. The domestic airliners reduced the airfare amid reduced passenger pressure. The flight fares differ according to the airlines company. The airlines companies are engaged in a price war to attract passengers. Amid increasing pressure, passengers were required to book their tickets 1 month in advance during the Dasai festival in previous years. Meanwhile, tickets have not been selling to full passenger capacity. Some airline companies maintain that the rate of flight occupancy from various destinations to Kathmandu has dropped down to 40%. The domestic airliners are in a dilemma to manage the operation cost amid the lack of passengers coupled with reduced airfare. The domestic flights that were halted for 6 months only came into operation since the 21st of September.
And in our Public Voice segment, we had asked the local entrepreneurs in Surkhet what should be done to ease trade and business that has remained disrupted amid the pandemic. Let's take a look at what they have to say.
Public Voice.
बैंक को चर्को ब्याज त्यसलाई चाहिँ बिना गराउनु पर्यो
कर्पोरेटरलाई पनि अलिकति सहुलियत गरिदिनु है भनेर भन्ने बैंकहरुलाई पनि सहुलियत गरिदिनु है भनेर चाहिँ अलिकति प्रेसर दियो भने दुईटैले त अलिकति केही न त केही हुन्थ्यो नि त
सरकारले केही नीति नियम लिएर राहतको प्याकेजहरु लिएर अनि जनतालाई अलि सहज ढंगले जाने गराउनु पर्यो
मास्कहरु सेनिटाइजर देखि टोटलीहरु आफूहरुले पनि युज गर्ने र अनि व्यवसायहरुले पनि आफ्नो पसल अगाडिपट्टि भिडभाडहरु अलिकति कम गराउने र त्यस्तै खालका गतिविधि गरेर चाहिँ व्यवसायहरु सञ्चालन गर्न सकिन्छ
व्यापार मिति चाहिँ कानुन बनाएर हुन्छ कि बैंकहरुले पनि सहुलियत ब्याज दर दिन पर्यो
करलाई पनि एकदम छुट त्यसपछि बैंक ब्याजहरु सहुलियत गर्दिएको भए पनि अलि राहत हुन्थ्यो
उद्योग व्यवसायका मान्छेहरुलाई पनि तिनीहरुको अवस्था हेरेर राहत दिने यताउता गर्नु पर्यो
And now time for our segment Public Pulse, where it texts us with their opinion.
Public Pulse.
And the question is, what's your take on the government decision to compel COVID-19 patients to manage treatment costs themselves? And our options are: option A, trying to evade responsibility; option B, can't be expenses; and option C, anti-constitutional. The voting is on. Type any WS, select your option A, B or C and send it to 34001 to share your opinion with us. And those were our latest headlines. Stay with us for more news and entertainment on KTVSD. Stay safe and good day.